I wanted to do something to give back. And my mother and my grandfather always told me to give back to the community. They were big on giving back. And I just remember having people believe in me when I was younger. And had it not been for those people, I may not be here. So I wanted to help out.
It's when you can get to that point that you're really sharing from here and you're hearing the stories. And I think that that's where I get my inspiration.
The payoff is something that you couldn't possibly ask for unless you're actually there in the field, being with the community and just doing the work itself.
There's messages out there that you can bring to people and have them change their behavior on how they take care of themselves or take care of their children or take care of their grandchildren is exceedingly exciting.
Health equity means a fair and just opportunity for everyone to have a healthier life. This means removing the obstacles such as poverty and discrimination, and lack of access to things such as good jobs with fair pay, safe environments, and health care.
So this is what's guiding us to things like jobs, like lifting people out of poverty, like having housing, access to fresh food, educational opportunities, and so forth.
The RWJF Awards for Health Equity program is a 7-year program initiated in 2015. The awards program recognizes and celebrates individuals who have successfully implemented systems changes to reduce health disparities. 9 organizations have been selected to administer the program. Each of the grantee organizations shares our vision for building a culture of health and achieving health equity in the nation. Our award winners' stories share several themes: community engagement, partnerships, risk-taking, and thinking outside the box.
Everybody has an idea. Everybody can give us a way to address these issues when it comes to the community. So there are a lot of sources that are untapped. We're just really trying to bring everybody together to discover those things together.
You have a vision, but you also recognize those that are around you that also have a similar vision, and you sort of work together. And so you know what you bring to the table, but you also understand you don't have all the answers.
What we do is so collective and it's so integrative, and it's never about one person or one idea. It's about supporting each other and each other's ideas.
You are not alone in this effort. Sometimes you feel like you're a one-man band, like, oh, we're the only ones that are doing this, but the community is willing to be there for you, to work with you hand in hand, to really reach out and tap those sources that are out there.
I was very surprised that our young adults were really interested in getting involved in giving back to the community and really helping other youth succeed that had been through some of the same struggles that they had been through. And it's a beautiful thing to see. It's hard to really explain without seeing it in motion, but it's very powerful.
We're learning a lot about what it takes to actually make this type of systems change in a community. The successes, the challenges, there's so many lessons to be learned.
To be a systems change agent, what it means is when people see you, they know that they're going to think, maybe we should do the simple things that can make powerful changes.
The motivation should be, how do we make people well? How do we keep them out of becoming sick and be at risk for sickness? To me, that's what's a critical expectation to have, that we get on the front end of things instead of letting things get too far.
We want to work to have multiple levels of influence, and in order to have that multiple level of influence, we have to be alive. If our programs are alive and living, then we are continuously able to learn from the families we work with, from the children we work with, from the teachers that we're working with.
We have a successful healthcare model. We would like to take that successful healthcare model to other places because we feel like it's something that can work. We feel like a toolkit of best practices could really help to move others in the direction that we're doing.
The winners are dedicated, amazing individuals who are pioneering game changers in the work that they do to develop and implement solutions for achieving health equity.
I'm just really a champion for health, and I just have a lot of passion around our community, and I just couldn't say no. And You just knew it was going to be a great project, a great process to help improve the health of the community.
The divine intervention that occurs, or that I call divine intervention, others might call it other things, but with our program there are so many things that happen that can't be explained. I felt like there was somebody else walking this journey with me.
I would really encourage people to get engaged, to find where your passion is at, and to know that when you're working with the community, there is such joy when you get to learn their stories. So I'd really have the message that know where your heart is at, and that's what's going to drive you.
The RWJF Award for Health Equity brings true recognition to their work on a national level through both the organization who's provided the award and selected them as an award recipient, but also through the recognition of the foundation. And I think bringing that attention to this work is very important for them and for the field.
Getting the Robert Wood Johnson Foundation Health Equity Award means a lot. It means that something is happening and that I'm a part of something that's greater than myself. And when other people recognize that, it's just an honor. And it inspires me to do more.
To be recognized outside of myself, by my peers, by the people I look up to and respect for being subject matter experts, for having a passion in what they do every day, and then bestow upon me that same kind of feeling. That's such a joy. I get very emotional about that.
It's making tears well up in my eyes, because it really is special to know that people appreciate all the work that you've done on behalf of your community, because I'm not accepting this award for myself. It's for myself and the rest of our organization that's worked so hard.
I cried. Honestly, I was in total shock. I mean, I could cry now. My new executive director was at a conference and she's like, "Congratulations on your award." I'm like, "What award?" And she sent me a notification and I broke down crying. I just couldn't believe it.
You know, when I found out that I was one of the award recipients, I thought, oh no, where's our team? Everybody should have won. We needed to have all of us here. But what I did feel was extremely honored and extremely happy. And I am just so very thankful for all the work that's done at Robert Wood Johnson Foundation. And I'm just really happy to be a part of it.